fungal skin infections, or otherwise known as tinea infections. So in this lesson, we're going to talk about a variety of different tinea infections. We're going to go over their clinical presentation, how we diagnose them, and finally how we treat them. So tinea infections are infections with fungi known as dermatophytes, and they come from the genus Trichophyton or Epidermophyton. And here are the images of those Trichophyton and Epidermophyton. Now, the pathophysiology of tinea infections involves the fungi metabolizing the protein keratin in our skin, nails, and hair. This is how they actually present and why they actually look the way they do. Because fungi metabolize keratin, it leads to lesions, scarring, brittleness of the nails, and dryness, that type of clinical picture. Now, the tinea infections are actually named depending on body location. If there is a tinea infection on the trunk, it's known as tinea corporis. If it's an infection on the feet, it's tinea pedis. If it's an infection on the head, it's tinea capitis. If it's an infection of the groin, it's tinea cruris. And if it's an infection of the nail, it's tinea unguum. So we're going to talk about each of these in more detail in the next couple slides. So the first one we're going to talk about is tinea pedis, otherwise known as athlete's foot. This is probably a very common one that many people know about and probably have had. It is the most common dermatophyte infection, and it presents in a few different clinical presentations. The first one and the most common presentation is an interdigital tinea pedis. This is the most common presentation. It's pruritic, it's erythematous, and scaly. So we can see in this image here, again, it's very scaly looking, and this can be quite itchy for patients. Then another presentation is a hyperkeratotic presentation. Again, this one's erythematous, but mostly involves the soles of the feet. And the other one is a vesiculobullous eruption. And again, this can be pruritic, so itchy, but also very painful, and it happens on the medial foot. So interdigital, so between the toes, hyperkeratotic is normally on the soles of the feet, and then a vesiculobullous eruption occurs on the medial foot. So again, if we take a look at this image here, we can see the noticeable scaling in this interdigital presentation. Now, the next one we're going to talk about is tinea corporis. Tinea corporis is also known as ringworm. Again, this one affects the trunk. So when we say trunk, it really basically means anywhere on the body except the hands, the feet, the groin, or the face. And this one is also pruritic. And as you can see in the image, is a circular oval in shape. And it too is also scaling patch or plaque. So it's a patch or plaque. Patch is a flat surface or flat lesion that's greater than 1 centimeter. Plaque is a raised lesion greater than inside outward. So it can continually get larger and larger from its central location. So again, we take a look at the image here. It's a demarcated, very well demarcated circular oval. And when we take a look at the lesion itself, it's scaling patch or plaque. The next presentation we're going to talk about is tinea capitis. Tinea capitis is a fungal infection of the head, and an easy way to remember this is capitis cap. So you can think of the cap of the top of your head, or you can put a cap, a baseball cap, on your head. So this is how you can remember tinea capitis is an infection of the head. And this leads to hair loss, and it too is also pruritic and scaling. And this one is actually more related to a direct contact transmission, so another individual that can have another tinea capitis. So again, you see this patchy hair loss with this characteristic scaling appearance. The next presentation we're going to talk about is tinea cruris. Tinea cruris is a fungal infection of the groin area, and this is commonly known as jock itch. And this affects men more than women. And what happens generally in this presentation is that it begins on the medial thigh, so the inner sides of the thighs, and it also spreads centrifugally, so it spreads from its center outwards. It's also erythematous and elevated, so it becomes well demarcated because of this. And it has associated in men or someone that's very active, they can become very sweaty in that area, and it can lead to this jock itch. Another associated factor is diabetes and obesity. and also immunodeficiency. So all these can relate to getting jock itch or recurrent jock itch or recurrent tinea curis. The presentation we're going to talk about is tinea unguum, and this one is basically a fungal infection of the nail. I have an entire lecture on this topic if you want more information. It's also called onychomycosis. It is basically a crumbling, brittle nail, just because the fungi is actually digesting away the nail itself. And it leads to a yellowish, opaque nail. And you also, if you're to take a look underneath the nail, you get subungual hyperkeratotic debrosis. Involves doing a KOH preparation of skin scrapings. And what you would see is you would visualize segmented hyphae. So you'd see an image like this, and you would see these segmented hyphae like so. And a lot of times we don't do this. We may just do a clinical diagnosis of the tinea infection. So once we made the diagnosis, how do we treat it? Treatment typically involves topical antifungals or medications with azole at the end of their name, the azole suffix. And you can think of medications like fluconazole. And another one might be butenofine. So majority of cases and a majority of tinea infections are treated with topical antifungals. But there are two special cases I want you to think about, and I'll tell you a way to remember them in a moment. So the two special cases are tinea capitis. In tinea capitis, so the top of your head, we're going to typically use terbinafine or griseofulvin. And the second one is tinea unguum, or the fungal infection of the nail. And we're going to generally either use an oral antifungal or ifaconazole for a very long period of time, about 4 to 8 weeks. So a lot of times we've been moving away from oral antifungals just because of some liver toxicity issues. So we're more going toward ifaconazole, which is also a topical treatment, but it's a more special topical treatment for tinea unguum. So these are the two special cases, and I told you I'd tell you a way to remember them, that the top of your head and your fingers. So they're basically the extremes, right? So the top of your head's the highest up. It's basically the extreme of your height, and all the way down at the bottom of your feet, at the tip of your toes is the other